Hello, Regis NU606 Advanced Pathophysiology students. This is week 10, the teaching presentation for Group A on Diabetes Type 1 and Type 2 by Catherine Stockey. So let's talk about diabetes. Diabetes has a Type 1 and a Type 2. Type 1 is mainly in children and adolescents, and the pancreas produces little to no insulin in the tissues. The amount of insulin required is greater than the insulin being produced for adults. Genetic predisposition, exact cause is unknown, and there's no way to prevent it. Genetics are genetics. Type 2 is a decrease in the pancreatic beta cell production of insulin and the inability of insulin sensitivity to respond appropriately to insulin within the body. It develops gradually in older adults. Type 1 diabetes pathophysiology, again, occurs more frequently in children and adolescents, but it really can occur at any age. There is a genetic factor, and deficient of insulin results from the destruction of the beta cells. It's an autoimmune reaction, and it results in the absolute deficit of insulin within the body. This can also be mediated by an immune response, and it is idiopathic. Again, the pathophysiology of type 2 diabetes, as you can see here, is really the resistance to the action of insulin. It has a decreased effectiveness of insulin within the body, and type 2 diabetes can usually be regulated by diet and exercise. So let's discuss the risk factors of both type 1 and type 2. The risk factors in type 1 diabetics is usually genetics and family history. The ADA recommends that anyone with a first-degree relative that has had type 1 diabetes is at a higher or an increased risk, and usually a simple blood test can tell and diagnose type 1. Diseases of the pancreas can also cause and lead to type 1 diabetes, and infection and illness as well. Risk factors for type 2 diabetics are a family history as well, but usually it's a BMI of greater than 23. They lead an inactive lifestyle, have high blood pressure, have abnormal blood cholesterol and lipid levels. They may possibly have had gestational diabetes when they were pregnant. They are older than 40 years old, and they have impaired glucose tolerance or impaired fasting glucose as well. Three complications of diabetes that we can talk about are heart attacks and strokes. And this is due to atherosclerosis, which can affect the large arteries and peripheral vascular disease. The obstruction of arteries in the legs, it can result in ulcers, which are seen typically on the feet and legs that are very slow to heal. This is due to the aggravation of the peripheral neuropathy, which reduces pain sensation, and usually patients have pain when they walk, which can also reduce their mobility. Amputation may become necessary if gangrene is present. The third complication that can happen is neuropathy, which leads to numbness, loss of sensation, and muscle wasting. This can result from ischemia and altered metabolic processes. These changes occur in many tissues and with both types of diabetes, especially when blood glucose levels are poorly controlled and the metabolic pathways are altered. A1C is what measures, it's the glucoside hemoglobin test used to screen people for clinical and subclinical diabetes. This is seen with a fasting blood sugar equal or greater to 126, taken on more than one occasion, and is typically an indicator of and can confirm pre-diabetes. An acceptable A1C level is anything under 7, and staying within these ranges can reduce a person's risk for diabetes, for complications, and long-term effects as well. So what are some medications that we use for diabetics? Well, for type 1 diabetes, insulin is the medication of choice. It's used in type 1 with the pancreas not being able to make insulin and those beta cells have been destroyed. They need insulin from the insulin shots and the insulin medication for glucose to be gained from meals for the body. Insulin has an onset, a peak, and a duration, and this helps to understand the length of time before insulin reaches the bloodstream and begins to lower blood pressure, the time in which insulin is at maximum strength in terms of lowering blood sugar, and how long insulin continues to lower blood sugar. Metformin is a medication that's used with type 2 diabetics. This medication is an oral form and is used to help control blood sugar levels along with the help of diet and exercise in people with type 2 diabetes. So as a wrap-up, diabetes is a serious health crisis with serious complications with an increase of death. In 2019, it was estimated that 4.2 million adults aged 20 to 79 years old died from diabetes, accounting for 11% of all deaths. The number of deaths attributable to diabetes is higher in women than in men, and diabetes imposes enormous financial pressure on the national healthcare system and national economies. Socioeconomic status like education, housing, environment, food environments, and lack of healthcare all contribute to this ongoing health crisis of diabetes. Thank you.